Hi, in this video, I'm going to talk about what a therapeutic care plan might look like in a classroom for children and young people who have experienced trauma at home. Firstly, consider consistency. Consistency is calming in that it supports an experience of predictability that is often absent in an inadequate home environment. Whatever you plan to do as part of a therapeutic care plan, only start what you can maintain consistently over time. In addition, turn your mind to aspects of classroom life that occur sometimes. Do any of these sometimes things readily convert into something that can occur regularly? If so, do so. Turn a sometimes thing into a regular thing. Secondly, check in proactively with the child or young person in your class who has experienced trauma at home. Checking in proactively supports their experience and learning that you are there for them, without them having to go to any lengths to make it so. It also supports their experience of their worthiness of care and attention. Thirdly, if you find yourself going to ask a question about the experience of the child or young person in your class, and you think you know what the answer might be, should you ask the question, don't ask it. Say the answer. Acknowledging the child or young person's experience in this way supports their experience of being heard and understood by you, their trust in you, and their emerging belief in their self-worth, where self-worth can be regarded as playing an important regulating influence over their approach to life and relationships at school. Further, verbalizing understanding in this way supports expressive language development and use, as opposed to the child or young person communicating about their experience through behaviours which may not be desirable in the school environment. Fourthly, spend a few days keeping a record of all the requests that the child or young person makes, or any action that they take to independently secure a response to a need. Now, these need to be independent behaviours that you will allow. They should also be requests that you respond to. If you can anticipate any of these requests or independent actions to secure a response to a need, don't wait for the child to do anything. Respond to the need proactively. Responding to needs proactively also supports a child's emerging experience of self-worth, which has a regulating influence over their approach to classroom life and relationships. Responding to needs proactively also reduces the child or young person's preoccupation with their needs and with responsiveness to them, and associated demanding, controlling, or overly independent behaviour to reassure themselves about access to needs provision. Fifthly, when you're engaging with a child or young person in your class who has experienced trauma at home, try matching their emotions as expressed by them, if only briefly and in moderation, and then return to calm. Engaging with them in this way supports their experience of connection on an emotional level and their capacity and willingness to regulate their own emotions and associated behaviour while at school. Finally, keep a record of all the times that you implement some aspect of the therapeutic care plan and familiarise yourself with what recovery from trauma at home looks like for children and young people. Unless you're thinking about these matters, you may not notice them. Noticing the progression of the child or young person in your class and your own delivery of aspects of a therapeutic care plan is anticipated to support your endeavours, including through inevitable tough times. If you took something valuable from this video, please consider liking it and check out my other related videos in this playlist. I also suggest that you consider looking at my blog site, Attachment and Resilience, with the web address colbypearce.net, and also the Secure Start website with the web address securestart.com.au. Both sites provide additional information that you may find helpful in the development and implementation of a therapeutic care plan in your classroom in the pursuit of better outcomes for children and young people who have experienced trauma at home.